Hi friends, welcome to classes by Lab Doctor. In today's class, let us study about treatment of atherosclerosis briefly. As you all know that atherosclerosis is very rampant and atherosclerosis begins at a very early age, including first decade of our life, and with our lifestyle, with our food habits, with our exercise pattern, the atherosclerosis prevalence is increasing day by day, and we would want to know the treatment of atherosclerosis. So in our videos we will briefly touch upon what are the treatment option for atherosclerosis. So atherosclerosis, the treatment option would be divided as non-invasive and invasive. So non-invasive would be something like lifestyle changes. It could be your diet, your exercise, your stress, your weight management, etc. And then comes the medications or the tablets. So these are the non-invasive methods. Then you have your invasive methods, where we will have to intervene to save the patient from that kind of heart block, etc. Like we might have to do a cardiac intervention, we might have to do an angioplasty, we might have to do a mechanical thrombectomy, we might have to go and remove the thrombus mechanically, we might have to do percutaneous revascularization so that we establish the blood flow, we might have to do stenting, or we might have to put some stents surgically. This is the invasive way. And also carotid endarterectomy, when the carotid arteries are involved because of atherosclerosis. These are the usual drugs or the tablets which we tell the patients, and you can see they are classified as statins, fibrates, niacin, bile acid sequestrant, etc. So there is a recommendation of these drugs in various dosage and the timings, etc. But we will just see in brief what are these medications, how do they act, and let us just see what are the uses of these medications and also the side effects. So the medications, whatever are there which we use in atherosclerotic patients, one is, yes, we use them to lower the cholesterol level. We want to see that the lipid profile is balanced. We want to reduce the dyslipidemia. So we give medicines to lower the cholesterol, which we were talking about, the statins, the fibrates, the niacin, the bile acid sequestrants, etc. Then we also have to control the other risk factors. If the patient is having high BP, we need to give medicines for his BP. If the patient is diabetic, we need to control his sugar with insulin or tablets. If the patient is at risk for blood clots, we have to give him tablet to reduce the blood clots. So everything is included when we talk about treatment of atherosclerosis. The managing the lipid as well as treating the risk factors for dyslipidemia. So first let us start with the statins. So you know that statins, what they do in the cholesterol metabolism, we have an important enzyme called as HMG-CoA reductase. So with the help of this, the cholesterol metabolism is maintained, and this statins will inhibit this HMG-CoA reductase. So whenever you have to understand the statins, remember that these statins, they are the class of medications which we use to lower the high cholesterol and to reduce the heart attack and stroke risk. So statin doses are often categorized as low, moderate and high intensity. So when I say that, you know, high intensity statins, these are the one which will reduce the cholesterol, the bad cholesterol, LDL, by more than 50%. Like you have atorvastatin, etc. They will reduce the LDL by more than 50%. They are high intensity statins. Then you have moderate intensity statins. That is, they lower the LDL or bad cholesterol by 30 to almost 49%. So you have your lovastatin, you have your fluvastatin, etc. So these are moderate intensity. And then you have low intensity. They'll reduce it to little bit. They are by around 30%. So you have your fluvastatin, you have your simvastatin, etc. So these are the ones which will reduce the cholesterol in varying intensity, and depending upon the patient, the doctor will choose the kind of statins he has to put them on. I've told you one is statin. So what does the statin do? They block the endogenous cholesterol biosynthesis only. So these are statins. The only drawback with this is sometimes, you know, this can lead to diabetes, it can lead to myopathies. Then there are certain enzymes or certain drugs like ezetimibe, etc., which will block the cholesterol intestinal absorption. Okay, so when they will block the cholesterol intestinal absorption, the vitamin absorption also might be impaired, and you might get certain deficiencies. Then you have certain drugs like alirocumab, etc., which will interfere with the LDL receptors, so that in that way they will try to reduce the cholesterol level. The side effect would be that sometimes it has immunological response, and also the price of this would be a little bit high. And certain medicines will disrupt the LDL synthesis, so they might cause hepatotoxicity, diarrhea. All this could be the side effects of certain drugs. So second category of drugs is the fibrates. So when these fibrates, what they do is they will decrease your triglyceride. So triglyceride is also a type of fat in your blood, and they will decrease this triglyceride. They will increase your HDL cholesterol. So if you have high triglyceride, then this fibrates would be helpful. So if you are having very high triglyceride and low HDL, this would be a drug of choice. So this fibrates, they will reduce the plasma triglyceride, they will reduce the chylomicron, VLDL remnants, they will also reduce the LDL size, they have anti-inflammatory effect as well. So this anti-atherogenic mechanism of the fibrates also makes it as a potent tablet. So this is the fibrate, and how it reduces the triglyceride, or how it increases the HDL, how it reduces the LDL level. All this are maintained by this activity by certain enzymes which are metabolized, or which are targeted by this fibrates. And the next medicine would be the niacin. So niacin is nothing but vitamin B3. This also helps us to reduce the risk of atherosclerosis and to improve the cardiovascular health. So how does niacin help? It will lower the cholesterol. So what it does is it will reduce the non-HDL cholesterol, and it will increase the HDL cholesterol. Like the fibrates, it will increase the HDL cholesterol. It reduces the inflammation and also improves the endothelial function. That is, it improves the lining cells of the blood vessels, and reduces the risk of atherosclerosis. Then there are certain medicines which are called as bile acid sequestrants. So what this bile acid sequestrant, like this cholesterol, etc., they will do, they will prevent or slow the progression of atherosclerosis by lowering the bad cholesterol levels in the blood. And this LDL is a major risk factor for development of the atherosclerosis. Now, how they do this? These tablets, they bind to the bile acids in the intestine, preventing their reabsorption. So they will prevent the reabsorption of the bile acid from the intestine, and when the bile acids are not there, the liver has to use cholesterol from the bloodstream to produce more bile acid, so that it reduces effectively the circulating cholesterol. So you can see here, this is the enterohepatic circulation of bile acid. This cholesterol is converted, it is excreted through the bile acids, and this is converted to bile acids, and that gets excreted through the fecal excretion. So what happens is, when they will bind to these bile acids, when there is less of bile acid, the liver is stimulated to produce more and more of bile acids, and the cholesterol is used. So excess cholesterol, whatever is there in the body, is eliminated to bile acid, and that is excreted to this feces. And this large excretion of large amount of bile protects against atherosclerosis, because cholesterol is now being used to synthesize more and more of bile acids. I have also told you that we also use medicines to reduce the risk of thrombosis, and aspirin is one such medicine. Aspirin is nothing but a blood thinner, and low dose aspirin therapy, it is recommended usually for the primary prevention of, may it be heart attack or stroke in certain people. So primary prevention means, suppose you have never had an heart attack or never had a paralysis, etc. You have never had a coronary bypass or coronary angioplasty, etc. But you take a daily aspirin to prevent such heart events. So the benefits of aspirin is stands debated. So it's always better to discuss with the doctor and start aspirin. So how does aspirin acts as an anti-inflammatory or anti-thrombotic agent? Because of the inhibition of this COX. So this low dose aspirin will inhibit this COX, and it has an anti-thrombotic capacity. Hence the arterial atherothrombosis, the venous thromboembolism is reduced. It also has an anti-inflammatory capacity, and hence it prevents this pericarditis, etc. So the benefits of this aspirin is that it will prevent myocardial infarction, it will prevent stroke, it will prevent the cardiovascular mortality, and the risk of it would be that it can cause gastrointestinal hemorrhage, intracranial hemorrhage, etc. So these would be the side effects of this aspirin. So here you can see the blood vessels, here you can see there is a tear in the blood vessels, here you can see the fatty material which is deposited, and here you can see it is blocked, and there is also a blood clot. So we also put the patients on this blood pressure medicines, so that the blood pressure medicine is not that it is going to reverse your atherosclerosis, but whatever the complications are there which are related to this disease, it can help to reduce that, and also help to reduce the risk of an heart attack. Sometimes we might have to give certain medicines for diabetes, so that the diabetes is controlled, and also for specific symptoms of atherosclerosis like leg pain during exercise, etc. For such things also we might have to give certain tablets. Sometimes even fibrinolytic therapy is used in the emergency situation. We just briefly saw what are the medicines when we see our patients or relatives taking this medicine, asking us as to why we take this medicine. You should be at least in a position to make them understand that these medicines are used for so and so, what are the uses, what are the side effects, how they act. That would help us to treat and understand the disease better. So that was in the brief about the medicines which we usually give to the patients who are having atherosclerosis and who are at risk of developing complications. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.